Hey everybody, I thought I would record something for people that are getting ready to have kidney surgery for removal of kidney stones. I just thought, when I was getting ready to have it, I was looking for information and you never really can find what you can expect and this and that. You just get, essentially what the doctors say and this and that. But I thought I would just give everyone a first-hand account for anyone that's going to have kidney stones removed, so they can, maybe have a better idea what they can anticipate and expect from someone that actually just went through it. Today's Friday. I had it done on Tuesday. Uh, a little history. I was born with a birth defect where my ureter wasn't open all the way. Um, I didn't discover this birth defect until a couple of years ago, so of course this was a problem as urine backed up and stayed in my kidney throughout my whole life. I was 31 when I actually discovered the birth defect, which now most of the time most infants, they can detect this birth defect from having an ultrasound, which they didn't start doing those on a regular basis until the late 70s, so I missed out by a couple of years. So usually having this defect is not fixed, your kidney will die in your teenage years, but for some reason, fortunately, mine made it. So what they first had to do, again, 2 years and 3 years ago in July 2009, was fix my ureter. And I'll try to move this here so we can kind of see. Uh, right here, the scars, that's where they went in. And then also here in my belly button, where they were going with the camera. So they fixed that. But the main problem I had was, since my kidney could never drain, I produced a whole bunch of kidney stones. To be exact, about 2/3 of my kidney was full of kidney stones. Small sizes, large sizes, quarter sizes, pea sizes, all sizes. After they fixed it, they tried blowing up a few with the lipotrophy. I knocked out a few, but the big ones, of course, it wouldn't budge. So a year and a half ago, I had to have the PNCL, or the percutaneous nephrotomy, whatever it is, something like that, where they actually puncture in the side of the back. And the first time they actually went in right back here. I have a scar somewhere. I can't find it exactly, but right up in here. And try to get all the stones. And they got most of them, but again, couldn't get them all. After that surgery, when I woke up, I stayed in the hospital one day. I had a catheter and I had a tube coming out of my back while I was in the hospital. That went right into the kidney. Because what that surgery essentially is again they just puncture into the kidney um, and go right directly into the kidney with a hole about probably about this size, but it heals down. And you can see my scar is only about that big. And they get the kidney stones out by blasting them out or even going in with an instrument. When I left the hospital that time, they took the tube out and my catheter out. And when I got home for the first few days, of course, your kidney has a hole in it. You're essentially urinating out of your back. I mean, it's not urine, it's the liquids that get into your kidney. Or some of it's coming out the hole, some of it, you're going to pass down through your ureters into your bladder and urinate like you normally would. Now, I just had surgery again for the PNCL on Tuesday, and again, today is Friday. Unlike last time, where I had pain for a few days and was out of work for about a week, I've had a lot more pain this time, and I'm feeling better now because, of course, I'm on some narcotics. This time when I actually left the hospital, when they did the surgery, they did the same thing, but they actually went in here, right here, and I do have a towel here just to catch the fluid when it leaks. I did have a bandage on that for the first few days, but again, it starts to itch and everything, and it's leaking less. And this time, as you can see, they left the tube in. Actually, not the tube. This is the tube right here. This white part from, I'm trying to so you can see it, from right here to here, and then you can cap it. So they left that in. but I was experiencing quite a bit of pain. They left it in this particular time. I don't know why compared to last time, but I did get a lot of pressure the next day on Wednesday when I went home and yesterday. So I actually did put my tube in, my nephrostomy tube. You can see it here. You see how it drains. I still have some blood in there. Now it's draining a lot less. I just emptied it about an hour ago. Yesterday, within an hour, this might be up to here. Um, pain isn't too bad. I am getting this out on Monday. The things you can't expect, again, I guess it's different for everybody. I think the tube itself causes pain because you just have a tube in your kidney, so it is hard to get comfortable. So if you do leave the hospital after having this and they leave the nephrostomy tube in there, expect to have more pain compared if they take it out. And even if they take it out or leave it in, expect to leak, because again, I leaked right here, even with bandages on. I'm trying to get this so you all can see. Right in here. Now it's still a leak around here. But it is a small little hole, you know, you can see the stitches right there. But I get this out on Monday. The pain has gone down, you know, I need to take a painkiller about every 4 hours, otherwise it's just, again, uncomfortable. But post-surgery didn't hurt too bad. You know, I mean, you're on quite a few narcotics. You'll take some antibiotics when you're done. The only thing I've had so far in the last 3 days, even when I have this nephrostomy tube capped, is I really don't have the urge to urinate, which that's not a major deal. But if you do have the urge to urinate and you can't, then of course you want to contact your doctor. So I don't know if this will help anyone that's expecting to go into surgery for removal of kidney stones with the PCNL. If anyone's going in for lipotrophy, I mean, that's going, they put you under general, and then you're good. One thing I will point out that I didn't mention about the PCNL, the worst part, and everyone needs to be prepared for this, they will put guide wires in before your surgery. So let's just say your surgery to remove the stones is at 2. They might have you check in at 8 and then have you go to the radiology department at 10, where they'll place guide wires, which is like a guitar string, you know, through your back, etc., through the kidney, so the surgeon can follow those guide wires down and get the stones out. Now, I had those done twice, and they are very, very, very uncomfortable. Not the procedure itself, but afterwards, very painful. The first time, you know, I don't remember anything. They don't put you out under general, but, you know, they give you the medicine. You can't remember anything. But after the fact, waiting to go to surgery, I don't remember it that well, but I remember it enough. And my girlfriend told me that the pain I had was intense. I had tears coming out of my eyes and everything. You will have the urge to have to urinate a lot because those guide wires, when they put them through your kidney, they'll run them into the bladder and connect them to the bladder to keep them locked in place. And of course, that gives you the urge to have to go to the bathroom. But I tried the first time, I tried like 3 times, and you don't need to. The second time I had it, I told the radiologist about, hey, I had a lot of pain after the fact while I was waiting, a lot of pain. Is there anything you can do to give me after you put the guide wires in while I'm waiting, because you're, again, waiting in the pre-surgery room to go to surgery, they cart you off. Is there anything you can give me, because they can't put you out altogether, but can you give me anything where the pain won't be there, I don't want to experience anything like I did the first time as far as waiting to go to surgery after the guide wires. And whatever they gave me, I barely remember it. That's good. So obviously, you know, you're not going to be in much pain if you can't remember it. You know, my parents were there this last time, and they said I was out of it, most times sleeping. A few times I woke up and was complaining of the pain, but again, I don't remember the pain, so I guess you really don't have pain. So that's the most important thing. If you're having a PCNL, when you get the guide wires, and I stress this, I mean, stress it, make sure. They're going to tell you, well, yeah, it could be uncomfortable while you're waiting to go to surgery. It's not uncomfortable, it's painful, and I'm not trying to say that to scare anybody, but let the radiologist, when you have those done, the anesthesiologist, let him know that, hey, I I want something when I am done, before I go to surgery, that will keep me out of it, because I've heard people tell me about the excruciating pain and I don't want to go through it. And stress that, talk to your anesthesiologist, and if they do for anyone that's going to have this what they did for me the second time, that's good. So that's the main thing you need to know about the surgery, is the guide wires. So again, hope this helps anyone that wants to, experience anything that has to have this done. Just give you a little first-hand information. Again, what, 72 hours out of surgery, got out of the hospital on Wednesday, today's Friday. Feeling pretty good. Again, on the narcotics, so I'll need a couple more here later. But again, hopefully this will give you guys that need to have surgery here a little first-hand experience. All right, hey, good luck, everybody.